I love fat grafting as part of breast reconstruction. For me, it's like icing the cake. It's putting on the finishing touches. But there's definitely things to consider if you're going to have fat grafting and whether or not it's a good choice for you. So first off, remember, fat grafting is just providing that final contour changes, adding a little bit of volume. It's icing the cake, it's not providing the cake. So don't have unrealistic expectations about what it can and can't achieve. Also, it's a surgery. A lot of women have a fair amount of pain from the liposuction. It's not a painless procedure. Definitely something worth talking with your surgeon about. The other thing that's really worth considering is the fact that it can increase your risk of needing a biopsy. I actually wrote a paper on this when I was a resident. But when we do fat grafting, studies show that about 60 to 80% of the fat survives, which means that 20 to 40% of it doesn't. And once again, this is not in radiated breasts. We don't have that data. When the fat dies, it's called fat necrosis. Now, if done properly and well, your body's able to resorb most of that fat, and that's why I inject fat in very, very thin aliquots using very, very small syringes. But sometimes your body can't absorb it, and it leads these little lumpy bumpies that you feel, which is terrifying if you have a history of breast cancer. Studies show that adding fat grafting to your regimen of breast reconstruction increases your risk of needing a biopsy by about 5%. I have awesome radiologists where I work, and they're really good at knowing scary from not scary, but this isn't always the case, especially if your radiologists aren't very familiar with fat grafting. So it's not a riskless procedure, but I think that it really can add a nice final touch to reconstruction. If you've had fat grafting, let me know your experience in the comments.